All you're going to do, and you do this to yourself, right? This is when you get to do yourself. You turn the ball on, number one, and then where you're going to go is at the top of the abdomen. I'm going to draw on you again. This is the rib cage on the right. This is the rib cage on the left. Okay. And then coming down that center line, this is where your lymphatics are. So I'm going to draw the line down, but remember, they're traveling up. Okay. The largest lymph node in your body is going to sit about right here off to the right. That's where the biggest congestion is, right here, and it gets stuck on almost everybody. And that gives you backflow of blood. Off to the left-hand side on most people is the abdominal aorta, and then that sends off those branches. That's superior mesenteric, inferior mesenteric. You remember what we talked about before, celiac, all those. So those are big arteries. And then you have the nerve centers. This right here is the celiac. That's your solar plexus. That's the main blood supply to this whole region here. That's the big dog. Then you have your superior mesenteric, your inferior mesenteric, and then I'm not teaching you here, your superior hypogastric, then your inferior hypogastric. But I want to go center line in there. I'll take the vibration ball, push it in. I like for you to go in pretty far. Try to go in about 1 inch if you can. And just let it vibrate. That's it. Breathe. Let it relax. 20 to 30 seconds. Then move down to the next spot. Press in, but don't cause pain. Then you move down to the next one. And I want you to stop and vibrate right over the navel. Okay? And if you like, you can work your way back up and work in that region. That's it. That's all I want you to do. This is when many people ask me, can I use like a massage gun? Like stuff like these? You've seen these? You know, because people have these and you turn them on, they're like a thump, 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 thump. Okay. That's not vibration. That's percussion. That's different. Okay. I don't use these along the abdomen, and I don't use these along the spine on my patient base for one reason. This is jackhammer, like massive stimulation to the system, and you blow the circuits. Like, I mean, if you're a hashtag monster and you're an athlete and you just want to keep yourself tuned up, I got no problem with this. But this can be way too much for the people that I work with. So I start with the vibration. Once you can handle all the way up to the fastest vibration on the ball, then you could tiptoe into here if you want, keeping in mind that this is percussion. It's not the same as vibration, right? So that's what you would do for your sympathetics and the abdomen, sympathetic. Now, right here, put your finger behind the angle of your jaw, below the lobe of your ear, right there. Just don't press in too hard. That's where your cervical 1, cervical 2 vertebra reside. It's also where your largest lymph node in your neck lives. That's usually congested in most people, which will also irritate your vagus nerve, because your vagus nerve exits from the cranium and travels to here to come down the side of your neck. And the vagus nerve goes right here at your collarbone, right there. Then right and left. So your right side will come down and it's on this side. They're going to wrap around your esophagus like a vine on a tree. And the vagus nerve is going to exit at the bottom of your sternum on here, the left-hand side, where the stomach is. And you've already going to help that when you stick your ball here, right? Because you're going to vibrate all these organs too when you go down the center, so you stimulate your vagus nerve. But this spot is a big kink spot for the vagus nerve. So I teach an entire 8-hour course on the vagus nerve. And that's a big spot where it gets hit. So watch. If the vagus nerve is exiting here and it's coming down here, My head position is important here because if I have my head pulled back and I'm centered over my torso, this nerve doesn't have a lot of tension in it. But if I live out here and that picture that you showed where my head comes forward, my upper back rounds, what happens to that nerve? It gets stretched and it can become kinked. So then you get vagus nerve dysfunction because you're living out here, right? So we want to use that thoracic one, but we want to free this area up because this is where things get stuck, right here. So you can take the vibration ball. You don't need it. You can use your finger. All I want you to do is rub right behind the angle of your jaw. If anybody follows my lymphatic work and you know about my big 6 lymph reset, this is spot number 2. Right? Spot number 1 is down here. It's also a vagus nerve spot. 1 and 2 help clear the waste from the brain and stimulate your vagus nerve. You can take the vibration ball, turn the ball on, low setting. You got 2 options. The first one, placing it there very lightly against the skin, barely touching it, because the harder you push, the more it vibrates and it hurts, and you'll get a headache. That's 1. 2, you take 1 finger off, you hold the ball, and you may not be able to see it, but my finger is vibrating. And you put the vibrating finger there as you massage where the vagus nerve comes out, right? So what are you getting here? You've already helped the sympathetic side, and now you're helping what? The parasympathetic side. But guess what? You also got the parasympathetic here and the sympathetic because the vagus nerve is here, but so are those ganglia. And just doing that, you've already changed blood flow to the sphincters. Later, we're going to actually open and close the sphincters, working our way around where the sphincters are located. You're going to be very targeted, very strategic along the gut tube travel access for food.